Hello, everybody, and welcome to another episode of Fireside Chicago, where we host fireside chats with prominent leaders from Chicago's business community, live on Zoom with Q&A every Tuesday and Thursday at 11:30 a.m. Central Standard Time. I'm your host, Tim Shum. I'm also the founder of Lucas James Talent Partners, a recruitment firm here in town. You can check us out live on Zoom. I have a slide of some of the upcoming shows that we have. You can check us out on podcasts, anywhere that you listen to podcasts, we're on there. You can also check us out on YouTube, Fireside Chicago YouTube, any way that you can consume content, you can find us. I'm really looking forward to the guests that we have today for a few reasons. John Bertrand is on the show. He's the CEO of IDX Technologies. I'll get into how I know John and our history together, but IDX is one of the first FDA, I think it is the first FDA approved artificial intelligence AI medical diagnostic device on the market. They have a product pipeline full of forward-thinking ideas that include artificial intelligence, AI, which many believe is the future of healthcare. John, prior to this, spent 13 years at Epic. Epic is basically, for folks that aren't familiar with the healthcare or medical market, Epic's basically the staple and standard software in the health system and hospital space. So think Salesforce or NetSuite, kind of in the private sector or commercial setting, basically the Salesforce for hospitals and health systems. John had various roles there of increasing responsibility, including leading global sales, product, and operations before joining 8VC. 8VC is a San Francisco venture capital firm as an executive in residence. EIR, or executive in residence, is basically a term for someone that's going to be supporting several portfolio companies at once. So John has a deep knowledge in healthcare, health systems, and he was applying that to the 8VC portfolio. John eventually took over as CEO of IDX earlier this year to lead their future growth and expansion, which includes planting roots here in Chicago. IDX is headquartered in Iowa, but they're starting to make a splash all over the Midwest, and doing some really cool things here in Chicago. So I wanted to have John on. John's one of those folks, I think we all have friends of ours. John and I went to college together. We both met our wives around the same time. We graduated, moved to different states, but John's one of those individuals, whether it's a coffee or a drink or a call, we see each other at weddings, maybe once a year or so. Each time that I talk to John, I always learn something. I think there's folks in our lives that tend to push you, that you'll learn something from, that you enjoy speaking to. So I would say probably about 10 or 15% of our conversations are always catching up on the personal front. But I always love just talking shop with John. So I'm happy to and excited to bring this conversation to my entire network and everybody that's a Fireside Chicago follower for our conversation today. So we're going to get right into it. Ladies and gentlemen, John Bertrand. How's it going, John?
Doing well. Thanks for the generous introduction, Tim.
Absolutely. So I know you really well, as I mentioned. Why don't we start off by just telling the listeners a little bit about IDX?
Sure. So we're the first ever FDA example or approved scenario where AI completely replaces the physician from the diagnostic process. To date, people that are introducing technology in this space really kind of nibble around the edges, assistive AI or like automated AI, where we're really just trying to guide a physician to a particular, say, spot within a diagnostic image, or we're maybe trying to automate the searching or culling of data. It's not really as explosive in terms of the value that it unlocks. It's actually pulling the most expensive human resource out of the entire healthcare workflow, which is the physician. So it's something that attracted me, again, because it's so groundbreaking. It's been something that's been attempted off and on for right around 15 years to do this. And our founder and executive chairman, Dr. Michael Abramoff, has kind of found some secret sauce on exactly how you do this in a way that ensures patients are treated safely, equitably, and the physicians are also aligned with it from an incentive perspective so that they're excited to bring this automation into healthcare.
Very, very interesting. I remember when you were talking about, this company and eventually taking on this role, just how exciting and interesting this is. So let's kind of like simplify it for some of us that aren't in healthcare. We both graduated from Purdue, you with honors, me, I was a 2.8 rounded up to 3.0 on the resume. So for folks that aren't as familiar with healthcare, talk to us a little bit about what the device does specifically if we were a patient.
Sure. So this is first indication here specific to diabetic retinopathy. I'm not a clinician. I have no clinical background, so I'm going to explain it in lay people's terms here for everybody, which is the direction you're giving me. Every diabetic patient in the U.S. should have this test done per standard of care in government and agency regulated metrics, quality metrics here. The reason for that is the 30 million patients in the US with diabetes, 80% of them roughly will start to develop diabetic retinopathy, which is a vision impairing and also vision taking progressive disease. So if you think about anyone in your family that might have diabetes or larger extended friend group, this is something they need to have to make sure that they can still see as they progress into their later years. It's very important because if you think about it from the actual person with diabetes perspective, if you look at surveys you'll do of them, they actually fear losing their vision more than losing their foot to amputation here. So this is very scary in terms of the lifelong impact it can have. One last comment on the disease state and why this is so important is 15% of the patients that should have this test done annually have it. And if you were to get the test annually and you catch it early, it's a completely preventable problem. But again, the bottleneck here in healthcare, for those that are maybe more just general business kind of minds, is the bottleneck is there are not enough physicians to test everybody and do the rest of the eye care related care the rest of us need. And if you look at just kind of incentives, doing this test reimburses at a very low rate compared to anything else the physician could be spending their time on. So we have this really interesting scenario where we know patients need this. It's incredibly important to them. And today, you have what's called a fundus image captured of your eye through a particular sensor. It's just a big camera that sits on the table. There's some handheld versions of it as well. But this image is then either beamed remotely or the physician reads it live, similar to think of an x-ray, right? It's very, very similar to that. Most people are familiar with that. It's an image to the back of your retina. I see you have a hemorrhage there. This implies that you're starting to lose your vision. Let's take an intervention. Let's prescribe you medication. Let's do an injection to stop you from heading down this path of going blind. So what IDX does is it essentially solves for this bottleneck where we have more people than we have providers able to do the care by essentially inserting a computer algorithm into the hardware to give you an instantaneous diagnostic. So it's really removing the physician from having to be involved in the workflow. Is that a little bit more on target for you, Tim?
Absolutely. So there's a lot of things there that are interesting. One is patient care. There's a huge impact there. Two, efficiencies of doctors and bandwidth of doctors. And three, it sounds like, I mean, I got to assume the regulatory environment and compliance related to healthcare and people's lives is of the utmost importance. So to be able to build a device like this that works and can solve all these problems is pretty amazing. And I think a lot of people that are looking at the healthcare space and the medical space, what is the future of healthcare? I think this is a promising first step. Wouldn't you agree?
I do. I think to boil it down for anybody that's not into healthcare or into like broader economic kind of concepts like supply and demand is really just, this is an example where instead of going to the physician's office, making an extra trip, spending an extra copay, inconveniencing yourself, having to take time off work, we're actually able to make it so that the piece of hardware, wherever you can put it, can be operated to provide you with insights into whether you're going blind if you're diabetic. And again, this is our first indication. We have visions of making it much larger and going other places, but it's following this general trend in healthcare of bringing care to all of us as patients where it's more convenient. You see retail clinics popping up in grocery stores everywhere. You see telemed here with COVID being an opportunity for people to get care in a more convenient way. We very much fit directly into that. Patients want more convenient options. They want more options. They want to pay less for their care. And this is kind of hitting all three of those at that intersection point where we're saying, look, anywhere you can place this device, as long as you can make space for it, and you have a high school educated person to operate it, we can essentially bring the physician, if you will, into this particular setting. So that's what we did here with this first indication and several more that we're working on right now. But to your point, it is regulatorily intensive. Every one of these is a clinical trial, FDA approved, something that takes a little bit more time, but we believe is the right way to do it, as opposed to some of the other alternatives proposed by some tech giants, which is just let's just throw a bunch of images at this algorithm and see what happens, and maybe patients will get hurt, but we'll see. We're very much taking more of the traditional scientific approach to building these.
Oh, so we have a lot of folks on the show from different industries. There's always this trend of, if you can build a product or create a service, that you're always putting yourself in the customer's shoes and saying, how do I make this easier? How do I make this more impactful? How do I make this more cost effective? You're going to be successful. And the healthcare market is just, it's a tough environment to do that. And as a patient myself, when I have a checkup or something, I just feel like it's such a laborious process that could be improved upon. And I got to imagine, creating businesses in this environment would be a huge challenge. Now, you have a ton of healthcare experience. We graduated from college in 2006. You joined Epic. I didn't know what Epic was at the time, but Epic, essentially exploded in the marketplace during that time. And you have a lot of experience. Let's talk about just the evolution of healthcare since you got into the space in the early 2000s. Talk about what it was like then, and maybe some of the improvements and efficiency improvements that you've seen along the way, and maybe where we could take it moving forward.
It's interesting you bring that up. It's actually done the opposite by every measurable statistic. Without getting too esoteric, when 2006 really was the beginning of kind of three phases that bring us to where we're at. The first was bringing digitization to your health record. Basically, doctors use computers now. In 2006, most of them still use paper if you look at the statistics. So that was kind of the first phase, and Epic was a big winner in that particular kind of time frame. And there were some regulatory incentives and reasons that kind of pushed that. And there's a whole debate healthcare is still having on whether that was a good or a bad thing the way that it was done. The phase after that was all about M&As for hospital provider organizations. So you have the Northwesterns, the Mayos of the world, the Sutters, all essentially buying up smaller healthcare offices and hospitals, just getting bigger. So first we introduced computers, which mean more time spent documenting into a computer. The nice thing is, as a patient, I now have a portable electronic record that more or less follows me where I go. And then the second phase was this economies of scale that everybody was essentially saying that they were going to get. Unfortunately, both of those, if you look at, again, any measurable report on the topic, has actually made healthcare more expensive and less efficient. So the third wave here is really twofold. It's looking to both automate and unbundle where care is provided. So this goes back to kind of what I talked about earlier. So unbundling where care is provided, this is, Tim, to your point, like making an appointment is labor intensive. They don't really seem to treat me like a customer all the time when I'm making these appointments. They kind of have this regulated environment where I have to go see them no matter what. There isn't really a whole lot of other alternatives when I say, want to go see a dermatologist, and the wait is 6 months, which is kind of a scenario I have to deal with because there aren't other alternatives. So you see people like CVS trying to introduce minute clinics, allowing patients to go in for a short menu of things, not maybe everything you do at a hospital. So that's the unbundling phase that's going on right now. This is trying to make it easier for all of us to go get care. People are recognizing that more access or easier access for patients means they're able to take better care of themselves, and in the long run, that's more cost effective. Think of it, it's just like your car. Getting your oil changed regularly is always going to be cheaper than waiting until the engine's smoking and you got to take it in. So people are trying to generally move that way. And the other piece is around automation. There's tons of startups, existing incumbent vendors are trying to do a bunch in this space. But that is essentially using AI, machine learning, computer vision, all these buzzword bingo type of techs. But the bottom line is it's very similar to what we have done and what we're going to continue to do, which is find areas where there are bottlenecks in healthcare and seek to automate that using computers while at the same time demonstrating equal or superior quality, right? Because the whole kind of premise behind any of this is, yes, everyone recognizes we want to make a change. We want access to be easier. We want to automate things, but we need to do it in a manner that doesn't make patient outcomes worse off in the long run, right? Because healthcare is a bit different than a lot of other industries in that health is essentially life. And so whenever you're dealing with this, it's not the same as making a trade-off like, I could ship this package and it could take 3 days or one. I'm going to spend a little less money. It's not the same as how fast you can get that order off of Amazon. we're actually talking about longevity, life here when you're making these choices. So there's an additional constraint every time you make a decision, and that's that making sure you're not harming the patient and you're producing at least as good of quality at a lower cost.
What are some of the other bottlenecks on just progress in general? So it's a really interesting point. You're dealing with somebody's life, their well-being. As a society, we've put regulatory red tape and compliance for obvious reasons. But then you have a lot of different stakeholders. You have these, a lot of M&A activity that you talked about. So these huge hospital systems that weren't there before. You have the insurance companies that play a huge role with this. But what are some of the other red tape in terms of allowing for future progress or allowing, technology to take hold like it has in other industries?
I don't know if it's so much the red tape, it's that you really need to understand all the constituents involved. Because when you look at any individual piece of regulatory, there's a reason behind it being there. And for me, I always try to start with, okay, why is this here to begin with? And it's typically because a patient was harmed in the past. That's usually the impetus for putting it there in the first place. But once you've understood why it's there, then it's like, okay, who is all impacted by this? Physicians, their first charge is do no harm. So they need to make sure they understand this isn't going to harm the patient per the oath they took when they started, heading down the path to become a physician. The health systems have to maintain financial solvency here, and they're already in a very low margin business. So you need to help them understand that by investing in new tech, this isn't going to be something that impacts their bottom line or their P&L significantly enough to cause them, an inability to operate. You have a lot of mid-level care providers whose plates are very full as it is, and they're being asked to do a lot. You need to make sure you understand how do you fit within their workflow. So, a lot of people point to the red tape right away. I would say, a lot of it's there for a reason. Usually when you ask a lot of questions and try to understand the history, you're like, okay, I get it. It's not a social media platform that you're launching when you're launching tech in healthcare, though. You can't just throw it out there and everyone can interact with it if they want or if they don't. You're talking about 4 to 5 different big constituents in every single one of those scenarios. We have to very deliberately make sure you're aligned with each of them and you understand their concerns when you're doing it. Now, because of the number of constituents, it does make things move a little bit slower. But the interesting thing I found over the last decade and a half is that if you do a good job understanding where every constituent's coming from and you make sure you're solving a problem for them, it's very sticky. So it's a very interesting business. You can get in there and you can figure out how do I make everybody happy, and you actually deliver on your promise. They're going to stick with what products you've provided and the innovation you provided much longer and more durably through economic cycles than most other industries.
So COVID's changed so many industries and it's accelerated trends. It's slowed things down. It's completely stopped or stalled a lot of things just in general industry. How has COVID affected some of the trends that have been accelerated, maybe in some cases, and where has it stalled some of the progress in healthcare?
Regulators and physicians and health systems becoming more open to technology would be the first and foremost, specifically technology that expands access. I think Senator Bill Frist, who's on our board and is a very large KOL in the space, came up and said that this has accelerated healthcare innovation by about 7 to 10 years by his judgment. And that's largely what we're seeing play out as COVID and its effects have been fully felt over the last 4.5 months. We're seeing deregulation around providers practicing through telemedicine across state lines. Normally you have to get licensed in every single state. They've essentially said, if you're on Zoom and you're providing care to a patient and it's within standard protocols and practices like it would be in an office, you can practice in another state. There's been a move in reimbursement from CMS, Medicare and Medicaid's essentially like a rate setting body, telling physicians, we're now going to support telemedicine at the rate you would have been paid had you seen the patient in the office. All these go back to your original point you made earlier, Tim, of like, hey, I wish care was a little bit easier and less cumbersome to get. Well, you know what? Physicians are now doing all this from home remotely and are like, this is actually for a lot of things, not everything, but for a lot of things more convenient for everybody involved, including us. We're really supportive of having this stick around in a lot of ways. There are some unintended consequences. A lot of care has been deferred that was not emergent. So elective procedures is what they're called in our industry. The funny thing is that not a lot of this is elective. So like, for example, our test, if you don't get it, you have a very high chance of starting to go blind, heading down that path towards blindness. That was considered elective because it wasn't related to like an acute medical condition in the moment. And now everybody on the provider side has these massive backlogs. Everybody still needs this test to be done. Their bodies didn't stop being damaged by diabetes in terms of their vision. Now they got to play catch up, but not only for just your single area you might focus on, but for everything. So there's, I think, going to be further opportunity looking forward over the next 6 months to 24 months to bring more automation in, because people are at a point where on the provider side, they're kind of hurting with the amount of backlog that they have to catch up on, and they're more willing and open to playing with new technology. So in a very, very strange way, in a very small way, that's a little bit of, I guess, a silver lining for most of us that weren't directly impacted by COVID in terms of our health or our family's health, is that we should see more speed of adoption around some of these things, because largely the relaxation on some of this, like telehealth and remote monitoring, has gone off without really to date any significant harm being reported, and people are feeling a little bit more comfortable about continuing at this speed of adoption.
Let's talk about AI a little bit, and I don't want to get like too futuristic. Before we hit the start and record button, we were both talking about a company that we both know that's basically robotics for surgery. You know, basically creating the bionic human that can perform surgery. And when I heard about this company, I was like, A, I guess that makes sense where we're at today. B, that sounds, it sounds crazy that we're there also, because surgery is a very intricate thing that you don't want to screw up, to our earlier conversation. Without getting too futuristic, let's talk about just AI in general, or adoption of technology. What is healthcare going to look like in the next 10 or 20 years in your view and IDX's view?
So we see here a world where narrow, specific situations are great for automation. We're not so much believers in this more large, big tech, hey, look, let's just throw all the data in the center, let computers churn through it and they'll come up with some conclusion. Because the examples to date where that has been done, every single one of this created some type of unintended harm. And there's many famous examples. If we had more time, I would get into. But where I think it makes sense to bring it in, and where I believe the medical community is going to keep trending us towards, is saying, look, what's a low skill task that's like something you learned your first year of medical school that, really pretty much anybody could do. And the mechanisms of the disease state are well understood. And when you are positive or negative for that disease is pretty measurable. That's where we see automation coming in. So that's going to be one piece. And the second is with the big pots of data that the EMR companies have created, you're also seeing massive trends on how do we then do a lot of the administrative tasks really quickly. 8 to 11%, depending on the study you read, of healthcare costs are purely administrative. And a lot of that is just moving data from one partner to the other within the whole value chain. So there's a lot of companies building in that space where I think they'll continue to unlock. What it's going to mean for us as patients, though, is that you are going to more and more have, again, low-level diagnostics done without a clinician actually looking at anything, which means a couple different things. One would be you can get it done in a lot more convenient locations. You'll know the result instantaneously. And the physician is going to move to more and more towards a consultative role on like how you should be managing your overall health, rather than this doer of transactions with you. And I think that physicians as a whole, if you look at how they're doing in terms of studies of opinions and their stress levels, this is something that they're ready for as well. Again, all those other things have made healthcare more burdensome from an efficiency perspective. They're looking to move back into more of the thinker role, where machines are providing them with data that's being done in captured and diagnosed in a scientific manner, and having them say, okay, based on the data I see here, you need to start exercising more. We need to get you on this particular, therapeutic, something more of that coach, that health coach than today, which is more of a kind of a mechanic in a lot of ways.
We have Tempest based out of here in Chicago. Eric Lepkowski started it, former Groupon founder, I should say. And they're tackling the problem in healthcare and using data and machine learning to get more predictive in terms of care around cancer patients, which is very interesting. And they've made huge waves here in Chicago, and it sounds like in the healthcare space. We had an interesting conversation last time we caught up around just the concept of, hey, if the goal is to live longer and more prosperous, there's only so much that technology and data and physicians can do. It's really on the individual to eat better or exercise more. And that concept around being a coach to someone, I think is really, really, really interesting. I think a lot of people out there that maybe, have a little issue kind of going on, just the headache involved in going to the doctor and just kind of getting it checked out. If that problem can be solved, I think you're going to see huge increases in waves in how care is adapted. Can we maybe talk a little bit more about that concept?
Yeah, I mean, it's a great point. If you look at every dollar that's spent on, say, like drug discovery, the actual impact on longevity of life is actually smaller and smaller every single time. And there haven't been really many breakthrough drugs or interventions in the last couple of decades that truly added on an extra 5-10 years to your life. We're kind of nibbling around, again, the edges, to reuse a phrase here. I think that the future is going to be more about, and you see this actually now with a lot of cool, innovative companies, about combining, engaging with clinicians at the right point in time, so access expansion, and then trying to nudge people from a behavior modification perspective. So like Omada is a great example of a company that does basically remote patient engagement around diabetic care and weight management, and the tie between the two is very clearly understood scientifically. But when the patient leaves the doctor's office, there's no coaching that happens anymore. So there is going to be, and continue to be, an expansion in that space around giving the patient these like polite nudges when you're not directly in front of the physician. So that would be kind of, I think, the big trend. Working in Silicon Valley at an investment firm out there, looking at deals as they came through. I mean, they were focused on healthcare, so keep that in mind. It felt like everything else was around patient modification. One great statistic I love out of I think it was an NYU study, but my memory might be escaping me. It's something like 35% of patients, when they get a prescription for an intervention, don't actually take it. So they went to the doctor. This prescription was given for clinically valid reasons to help you with your health and wellness, and you go home and you don't necessarily take it. So even just giving the patient a nudge through a smartphone, it's time to take your medication. You haven't opened the pill vial yet, it's time to take your medication, can have a dramatic impact on overall quality of life, cost of care, population health. And all you're really doing is this little kind of Bluetooth connection through Internet of Things to just remind you it's time to take this. So there's a lot to be done still. The first kind of wave I saw out of college with the digitization of healthcare records really helps with that. I think really where we're at now with COVID kind of meshes well with where we're at third wave wise, and we should continue to see quite a bit of innovation over the next 5 to 10 years.
Yeah, everybody knows like going for a walk or working out helps. Eating vegetables helps. It's hard to do, I think, for a lot of folks, some more than others. But I think, if there's something out there that can convert the mindset, or maybe it's an education or an awareness thing outside of what's going on in the health system, I think that's probably the next wave. And that's interesting to hear you say that at your San Francisco venture capital firm, there's a lot of deals that are going through in that context. With our last kind of segment here, let's just talk about Chicago a little bit. This is Fireside Chicago, or Chicago show. John grew up in Chicagoland area, went to school close by. If you look up John's LinkedIn, he's based out of San Francisco, but maybe talk about some of the roots that you're planting here in the city, and why you like the city from a business standpoint.
Sure. Well, to be fair, I'm actually standing in Lincoln Park right now in my apartment here, so I'm still in Chicago, just doing the third coast, left coast, commute back and forth. Or well, normally I was doing the commute, but not anymore. We're opening an office in Chicago. We're an Iowa-based company. But to continue to go faster, attract more talent, take advantage of everything that's going on in the city, we're opening an office actually right on West Wacker here in September. Would have been earlier had it not been for fate. But look, Chicago's a great city for a variety of reasons to build a business in. One, we have a massive talent pool around healthcare tech. We're one of the probably second to third med tech centers in the United States, arguably. There's tons of pharmaceutical talent here within the space, which leads you into pop health related endeavors as well. You've got Matter, the healthcare incubator, that's in Merchandise Smart, that does a great job bringing both large scale vendors in to look at new innovation to help you grow, but you've also got the community that's created around that, the collaboration there. That's a center that people fly into from around the country, from the healthcare provider space, to meet with new innovative tech. So, if you're hanging around Chicago, you're like, hey, I've got a healthcare idea. Matter's a great place to check out. They do a nice job really cultivating that environment. I've been an advisor there for like 5 years, I think now, and just joined as an official member now that I'm actually part of a company that's technically a startup. So the talent pool is amazing here. There's increasingly more capital available to build a business in the space. That's really exciting. And I think if you mix the increasing amount of capital with the tech environment around healthcare that already existed, plus the fact that traditional startup hubs are becoming debilitatingly expensive, and Chicago, by large metro areas around the world standards, is still incredibly affordable. You got some confluence of some nice factors here. Talent's here, the ecosystem's starting to really take off. I mean, gosh, when I moved away briefly and came back 10 years ago, it was like, I think I want to get into the startup thing. There was really nothing in town that you could tap into to find something fun to do. Now it's super easy. I feel like you go to like builtinchicago.com, you can go through a whole list of everything that's going on here and really very quickly connect with people. And then I would also add this is there's the attitude and pretensions of Chicago as a city are, in my opinion, they can be more conducive to building a business in that, look, there's a lot of great things you can say about other startup communities. And I would if we had more time, but there tends to be a lot of talk about what you're going to do. I don't know if it's the Midwestern roots or we don't have a big startup community here, so it's more focused on getting things done. But you talk with people more about things you're doing rather than things you could do, which is a bit more exciting. It's more focused on like, let's get this moving, let's get this done. And I think it makes for just an easier environment to really get some traction on your business with that talent within the ecosystem I mentioned.
Very well said. Very well said. We got 2 questions coming in, both from Sanjeev Bhatt. Thanks, Sanjeev. I'm just going to ask these real quick and we can close out, John. John, how do you see the competitive landscape in the eye exam area? There have been companies using smartphones to take images. Google's had a huge effort for image analysis. And then I guess the follow-up or the second question is, what's the adoption timeline for this, since compliance is usually a big issue that comes up?
Sure. So for competitive landscape for the eye exam, today it's your traditional physician. There are telemed options where the same image beams somewhere else. The third is it kind of bifurcates into what we're doing, which is full automation, and then what Google or others try to do, which is assistive, where they try to help the person. The value unlocked there, again, to the whole kind of all the constituents is limited because you still have a human involved in it. So from a general competitive landscape, we're competing again more than anything with helping people understand how we can fit into a workflow. That's our competition. How can we help you understand? How do we deploy this in a way that isn't disruptive? And it's generally being well received from pretty much anybody you talk to, because again, the supply and demand problems within this miniature marketplace in healthcare. Google's been very involved in image analysis for a while. Before that was IBM Watson, or you could argue they might still be in it. It's hard to really say when people truly shutter those type of R&D groups. I think the one thing that I've noticed over the years, I think I'm now at 15 years in healthcare, is that large tech companies, this is a side project for them. And they bring in wonderful technicians, but there's not necessarily a pairing with actual clinicians and scientists in that space. And as a result, they struggle a little bit longer than somebody that starts building with those type of that three-legged stool in mind. There's a little bit more of a delay there. And then when something else happens for their larger business, it's really easy to say, well, hey, this image analysis business hasn't really done anything for us lately. It's taking a little longer than we thought it would. Maybe we want to repurpose these brilliant engineers on something else. So, Google's been trying to do this through their Verily venture for some time. They're still not in a clinical trial, or haven't at least filed for one yet. So we'll see. Obviously as a small startup with Google saying they want to come into your space, I pay a lot of attention to it. But I think they face a lot of innovator dilemma style decisions as they look at their huge portfolio of opportunity in front of them. And then from an adoption timeline perspective, I don't know if we're talking sales cycle here or getting it out there, but it's pretty easy. Turnkey deployment was what we've got set up here on this. From the point you say you want to do this, usually the process limiting step is how fast your IT people can get on the phone with us to integrate it. Right now we're doing deployments sub 30 days. And then from an adoption perspective, we have customers that are hitting their 80% target compliance for their whole diabetic population per HEDIS NCQA standards. For those that aren't familiar, those are quality standards set for a variety of different important kind of wellness measures of preventative care. So we see good compliance. There's a lot of nuance in there that we feel is our secret sauce, but yeah, let me know if there's any follow-up on that one.
That sounds good. Thank you so much, Sanjeev, for the question. And John, thanks so much for carving out the time. I know you're busy. You and Seth are super busy, navigating this ship, getting IDX to the next phase of growth. I'm looking forward to having you back on and maybe the 2-year mark and the 5-year mark just to see what's going on with you and IDX, but much appreciated. If folks want to check out IDX, if folks want to reach out to you, where can they find you? Where can they learn more about IDX?
Well, IDXidiagnosis.net. We're working on a better URL, I swear. And then you can always reach out to me on LinkedIn. That's probably the easiest way to get a hold of me.
That sounds good. Thank you so much, John. We'll talk to you soon.
All right. Thanks, everybody. Have a good day.